Okay, we're just getting started on the left shoulder. We examined your shoulder before we started, and it was very unstable. It would easily dislocate to the front. And so we know at the very least we're going to be doing a stabilizing or shoulder reconstruction where we stabilize the ligaments and the joint. You've got what we call a slap lesion here. This is your biceps tendon. And as we pull back on it, you can see how this is lifted away from the bone. So one of the things we're going to do is called a slap repair, or sometimes a slap reconstruction. In order to do that, we have to take away a little bit of cartilage from this part of the glenoid so that we can get this to heal back to bone. It doesn't like to heal back just to cartilage, and so the bone looks kind of yellow once we remove the cartilage layer. And we're almost there. We'll keep working here a little bit more. So the other thing that we're going to show you in a minute is, so far your rotator cuff looks fine. We haven't really seen any problem in terms of tearing with the rotator cuff. There we can see we've got some exposed bone there. See how it changes color from white to kind of reddish? So that's exactly what we want. That's a good thing. And then we just expose a broad enough area so we have a good surface for healing. Okay, so I think that'll do well. Now we're going to look towards the back of the shoulder. And as we look back here, we can see that you've got what's called a Hill-Sachs lesion. This is what happens when the shoulder dislocates. And so as a result, we're going to do a particular type of reconstruction called a Remplissage. We'll show you that in just a minute. That's going to require 2 rotator cuff anchors. We have 1 open. We need 1 more. But that's everything that there is to show you. Here's the rotator cuff on the right. A little bit of fraying, but for right now, that looks pretty good. Okay. Okay, so we're looking from the front to the back. This is this Hill-Sachs defect. We're going to use our shaver just to roughen up the edges. There's really not much else to do. We have a pretty good shot here. And so we're going to place 2 suture anchors in. Okay, pause. Let me see the rasp. Okay, so here's our first triple loaded anchor. We're only going to probably use 2 of those sutures. But there's our first triple loaded anchor down. And we'll get to work on that in just a second here. Hold the camera. This thing always defaults back to 90%. Okay, so there's our first mattress stitch. We're going to pass another one from this anchor. I just want to show you we're making good progress here. You can see the black and white sutures are already passed. We haven't tied them. We're actually not going to tie those to the very end. Okay, pause. Okay, hold the camera. Okay, so we've got 2 overlapping mattress sutures in the back, which is what I like to do here. And now we're going to place another suture anchor up here a little bit more superior. So we'll take the guide and place that next anchor. No. Maybe. Why did it drop? Yeah. Yeah. Okay, so we've passed all the sutures. We've got 4 mattress sutures. It looks like a mess, but it'll make sense at the very end. Now we're going to work down the front of the shoulder. I need the shaver up in the front. We're going to work down the front of the shoulder. It's in the back. And we've got to place some anchors down the front here to secure this anterior labrum and capsule back to the front of the glenoid here, as you see. So I just wanted to give you kind of an interval report. You haven't lost too much bone on the glenoid, which is good. But with that bone loss, also on the humeral head side, that's why we do that, what we call the Remplissage. Okay, so we've got the first anchor in. You can see it there. We're going to reach in and take out one of the sutures. We're going to keep this blue cannula in. That's really important back here. And keep a hand on this back one, yeah. And now we're going to use our suture hooks, what we call a turn to the left hook, to pass through the capsule and labrum here. Okay, so there's anchor number 2. And just like we've done before, we've already tied the first one. See how it looks better already down there. But now we're going to go ahead and repeat the process with this second anchor. Hold the camera here. Okay, pause. Got it. Yep. Okay, so we've got all 3 suture anchors passed and all knots tied in the front. Looks a lot better. That cliff that we saw at the beginning is completely gone. We've got all the tissue reapproximated back to the glenoid. We still have that slap lesion to think about, so I'm going to put a switching stick in the back, and we're going to move the scope to the back of the shoulder. So switching stick in the back, and then we're going to have a look at this biceps anchor area. We still haven't tied the Remplissage sutures. That's at the very end. Okay, so we've got the biceps tendon anchored down, and it's not captured, meaning that it's still got flexibility on it, which is what we want. It still needs to be able to move and have some give and take. So you can see that it's still mobile. That shouldn't be a problem. And I'm happy with the way this repair looks in the front. The final thing we have to do, if you remember, is we've got to go back up here and tie these Remplissage sutures. But notice how it's getting pretty hard to see. So one final thing I'm going to do, I'm going to put the camera in the front, and then we'll have a look as we tie those sutures in the back. Okay, so here we're looking towards the back. I just wanted to show you before we tie the sutures what it looks like. And now we're going to get to work on tying these. Hold the camera. Okay, so we're done. And I'm going to turn on the water a little bit. You can see as we look back here, everything's completely sealed up. That gap we had in the back is completely eliminated with our Remplissage. So I'm really happy with the way that looks. Sorry for the picture, but we're just turning off the water and we're going to be done. But that looks great, okay? There's most anterior part right there. And we're going to finish up here and get you back to the recovery room. So good luck to you now. Bye-bye.